Meeting called to order at 3:30 p.m. First item on the agenda is the roll call. My name is Christine Riley. I'm a member of the Board of Health.
I'm Jean Maggio, and I am a member of the Board of Health.
My name is Mary Lou Cooney, and I'm the newest member of the Board of Health.
I guess we don't have to introduce the members because it's roll call accomplished that. We need to elect a chair and a vice chair of the committee.
I nominate Christine Riley as the chair of the Board of Health.
I second that nomination.
All in favor?
Aye.
The vice chair, I make a motion to nominate Jean Maggio as the vice chair.
I second that nomination.
All in favor? Say aye.
Aye.
Thank you.
Okay, unanimous on both counts. Next on the agenda is a review of the minutes for June 26th. I believe I sent these to both of you. Did you have a chance to look at them? Do you have any questions on them? Or do you want me to
Yeah,
just read them?
because I didn't have that email yet,
Okay.
I did not get them. so-
Okay. The previous Board of Health meeting was on June 26, 2024. Meeting called to order at 6:43 p.m. Members present, Bill Schmidt, June Holgerson, and Christine Ryan. The minutes of the Board of Health meetings on May 28th, 2024 and June 2024 were unanimously approved 3-0. Public comment, none. There were no reports. The letter grading of food establishments, the Board of Health voted unanimously to approve the regulations of the Winthrop Board of Health on letter grading of food establishments and food trucks. These regulations will take effect January 1st, 2025. Grease trap regulations. The board voted unanimously to approve Winthrop Board of Health regulations concerning grease trap regulations for food establishments. These regulations will take effect September 1st, 2024. Meeting was adjourned at 6:53 p.m. Adjournment was approved unanimously, 3-3. So we need to vote whether to accept these minutes.
I
Make a motion.
make a motion to accept these minutes.
Second it.
I approve.
Okay, minutes for the June 26, 2024 meeting have been approved. The next item on the agenda is public comment. Is there anybody who wishes to speak to the board about any matters?
Yes, John Morgan, Precinct 4. I want to welcome everyone. This is also my second Board of Health meeting, and I hope to continue coming to as many meetings as possible and to learn as much as possible. And I look forward to the future.
Welcome, John.
Thank you for coming, John.
John is also an advocate. He spoke at the town council meeting about White Cane Month, which I think is important for everyone to know and understand. John is also a member of the Disabilities Commission, and I've attended just one of their meetings recently where they did a program on preparing for emergencies. John has been a leading person in working with the Disabilities Commission and trying to keep them up to speed on all the things that people without disabilities have knowledge of. So John deserves a lot of recognition for the work that he does with the commission.
If you enjoy what you do, you never work a day in your life.
Profound words, John, always.
Any more public comment? Okay, we proceed then. Next on the agenda, we have an update from the Director of Public Health and Clinical Services. We asked Meredith to come and review with us kind of her role, her responsibilities, and also to find out if there are things that the board could be of assistance to you with.
Before we have Meredith speak, I just want to, I know we mentioned this at the council meeting, but I would like the public to once again understand some of the things that the Board of Health wants to expand. We're not just a rules and regulation commission. We feel that it's important for our community to understand health issues, to understand safety issues, things that pertain to everyday life. And so one of our intentions is to bring people like Meredith with her expertise to give a presentation. Will be televised so that hopefully we can get it out to the public. And so that more information is given out to the public in a number of ways. Obviously, we have the town manager's report, we have the transcript, and having public exposure to people at a meeting like this, we think is very important. So I just wanted to preface that with why we're having Meredith come and speak with us today, why it's so important.
Thanks.
Thank you very much.
Do you want me to sit over, is it easier for me to sit over there?
Sure,
Yeah,
that's the seat of honor.
Well, I've been in that seat a few times. No, about that. So I printed off, so this is what we had prepared for the budget. This was our budget memo for this year. It kind of gives an overview. It's all online too. And if anybody has reviewed like the budget book anyways, it's the same information. So this is just kind of a general overview of kind of the mission of the health department. So this is going to be a little bit redundant, but in Massachusetts, we have 351 independent boards of health departments. There is no centralized structure for our health in Massachusetts. So each one, 351, are very different. So the rules and regulations and also the application of public health can be very different from community to community. Obviously, our region is different than, say, Berkshire County or things like that. We're one of the few states, if not the only state in the country that does not do county-based public health systems. The state right now is trying to reorganize that and push people towards regional work, and they're using public health excellence grants to kind of encourage that. They're also encouraging collaboration and regionalization with within the opioid mitigation monies that they're distributing locally. So we're seeing a change in that. Luckily, Winthrop, Revere, and Chelsea had formed the North Suffolk Public Health Collaborative prior to the pandemic. So when the pandemic happened, so we are part of the North Suffolk North Suffolk Public Health Collaborative. That was formed, in 2018. That's organized and administrated through MAPC. So we meet during the pandemic, we're meeting weekly, if not more frequently. We now meet twice a month between the three communities. We had about 9 months of work beforehand. So when the pandemic happened, we were in a rhythm of doing work. So as the state was releasing money, they were releasing it with the idea that they wanted regional collaborations. We were already established. So that's why we were able to set up one of the first responder vaccine clinics, because we had structure in place. There's a few more areas within Massachusetts now that is doing that. Yes.
What does MAPC stand, what you said was administered by?
Oh, MAPC, it's a Metropolitan Area Planning Council.
Okay, thanks.
And yeah, so we are part of that. The town of Winthrop pays about $9,200 a year to pay into that. It's divvied up per by the population of each. So we pay the lease. It's administered through the city of Revere. It has been hugely beneficial to us. We used to pay a lot higher rate into this before MAPC took it over. So that's just kind of, like the regional work that we're doing. And then in terms of our staffing now at the public health department, so it's myself and then we have a public health program manager. And we have really five, you could say almost six different sub-programs. So we have our substance misuse program, which is the CLEAR program, the Community Law Enforcement Assisted Recovery Program. Also within that is our mental health program. So under the auspice of behavioral health, we have a peer recovery specialist, and we also have a second peer recovery coach. We have a crisis intervention social worker and a youth mental health clinician. Both of those positions are subcontracted through Boston Medical Center. We also have 2 open positions for behavioral health clinicians. We have we have a resource coordinator and a resource navigator. So those folks really, they came on board during the like mid-pandemic to after the pandemic. So they work with anything related to the social determinants of health, housing, food stability, job insecurities, really the gamut. Our resource navigator is bilingual. Well, she's multilingual. She speaks fluent Spanish and also Portuguese. And she is often called to translate for other departments now as well. So she'll be, it's not uncommon for her to be requested to go to the police department or to go and meet the fire department someplace and translate for them. And then we also have our infectious disease lane, and we have Lori, who is our regional public health nurse. So she is through the Public Health Excellence Grant. She's shared within Winthrop, Revere, and Chelsea. So she navigates any infectious disease cases we have in Winthrop. We no longer follow up on COVID, but we had last summer, not this past summer, the summer before, we had 6 cases of monkeypox. And so she managed that, for example. And then she does all of the tuberculosis management. So those are the 2 that are like really intensive, heavy in terms of outreach, follow-up, and case management. And then we have the MRC, which has always been so helpful. And we also have domestic violence and sexual assault case manager. So she works 20 hours a week. So she kind of leads anything related to intimate partner violence. So that's our staffing. In terms of staff, that the majority of our staff are paid through grants. My salary and the public health program manager and our peer recovery specialist. So my salary and our program manager are covered under the town budget. A portion of our peer recovery specialist salary is covered under the town municipal budget. The rest are all grant funded. So the grants that we manage currently we have a Department of Mental Health Crisis Intervention jail diversion grant that we've had for now 10 years. We have an Equitable Approaches to Public Safety grant that we've had for 3 years now. That's through DMH. We have a COVID-19 sexual assault and domestic violence survivors fund that is managed through DPH also. And we have a youth mental health improvement initiative that is managed through Health Resources in Action. And we have a no-cost extension for a grant that we had last year for data modernization as well, that we are figuring out how to pull data in a more concise manner into, so we're not hand counting things as much as we do for our data collection now. So do you guys have any questions?
Yes.
Yeah, you can just judge my stuff.
So how do we get the word out to the public that says, if you need help and all the things that you mentioned, whether it's drug related or mental health or things, how do the people in our community know where to go, who to call, how to reach out? Is there a central phone number? Do we put it in the paper? How do we do that?
We keep on, so there are two different ways that folks seem to be interfacing with our programs. One is through the public safety world. So um, myself, our clinician, and also Lieutenant Jajarian. So Lieutenant Jajarian had been assigned full-time to the health department for 2 years. So he'd been conducting outreach. He is, he's hyper trained in the world of mental health, harm reduction. The really interesting thing, and which is also, important to note, and I should have mentioned this before, is that he co-leads the CLEAR program with myself. Right now, one of the things that we've done this year is we've been able to train 3 additional officers. It's an intensive training that we've developed for police officers that are going to go out and do this work. So the recruitment process is not that they get assigned this kind of a role. It's tell us why you want to do this work. And then they go through peer recovery coach training, they go through ethical training, they go through motivational interview training. And so we had our first officer about 1.5 years ago that started going out with Lieutenant Jajarian. And now we've trained 2 additional officers. So that second officer is now training 2 others. So they're putting a quasi-internal unit within the police department. So Lieutenant Jajarian is now overseeing the other officers that are doing this work. So we're able to close the loop on our follow-up. So if we identify, and it's either myself, Lieutenant Jajarian, or Jane Rupp, our social worker, in the police logs, something related to substance use, behavioral health, the resource navigation. For example, if the police are getting calls for unhoused folks, right? Like, we would go out and try to find them and give them, access to services, or try to figure out what is causing them, or what is the barrier to them either being in a shelter or being in a warm place, or really just building a trusting relationship with them. So we either identify people through the police logs, or we get referrals from community stakeholders. Like the fire department called me yesterday about a situation that they were concerned about. So we will get referrals from public housing, the senior center. So we have like a really good relationship with a lot of people. And then we have people that just email us or call us or hear about us. And we do have to get a little bit better about getting our name out there and letting people know that but we had our recovery event last week. There was a lot of like news around that. And yes.
Yeah, so the process, say for a parent who's completely, upset about the child's drug use, and what would be the process for them to?
Just call our main number, or we have an email. It's clearteam@winthropma.gov.
Okay, great.
So those are the 3 ways that we have people kind of accessing services.
So there is a process where an individual can request.
Oh, yeah.
Themselves or their family member.
Yeah, and our youth mental health clinician, who we just hired in August, we're working with CASA, and we're actually going to be, he and also CASA has a clinical intern. There's a high need within the middle school especially. They've identified some needs within their students. So they're going to be spending 2 days each doing direct clinical services for students at the middle school. Because we have done, and we're going to be launching another round of needs surveys. That one of the biggest gaps, and we've been there's been so much talk about it, is the difficulty with getting access to services and the length of time people are facing with that. So we've worked with BMC for greater than 5 years now, 6 years. They give us a lot of autonomy to do clinical work under their license as like a bridge until people. We're trying to hire an adult clinician too, but for a child to get access to services. So
Is there any relationship you have with, say, a detox place, or, that?
yeah, we just had a detox place here today. Like, we invite them in. So yes, we have like a list of, and unfortunately, it really depends on insurance. It depends on ability to pay. It depends on a multitude of things.
Of beds available.
Beds available. Yeah, we met with the Power of Recovery today. So they're an organization that's out of Lynn. They run, I think, 12 sober homes, and they're certified sober homes within our area. And they have they have a really interesting story behind them, but they really have like a boots on the ground kind of philosophy. So we've had people, clients of ours go to them, for example, and we've had great experiences with them. They usually are really flexible with scholarships and things like that, and trying to work with people. So we try to invite in organizations as much as possible for face-to-face visits. Especially on Tuesday, we meet every Tuesday and we roundtable cases, or we just do overall like staff meetings, and we will invite organizations in to present so that we have, it's nice to have somebody's cell phone number.
Exactly.
So
When you get a call at 12 o'clock and you need a bed.
yes,
recovery bed,
exactly.
Okay.
Yes. So yeah. So we say we say yes to anybody who wants to come in and talk with us or that wants to invite us out. We've gone to multiple field trips to Recovery Centers of America, or like to see what other organizations are doing and learn their process, because it's really hard to sit with somebody who is seeking recovery services and you're like, okay, so what's your insurance again? Well, let's call this place. No, sorry, we don't take it. We only have a bed space we have 2 beds that'll take Mass Health, but we have 16 beds if you have Blue Cross Blue Shield. Well, okay, but I have the extender on Mass Health. Like, we're not, it's a full-time job to try and figure out just the insurance piece sometimes. So we really want to build programming and access that is completely not dependent on third-party payer systems. And so that has been, we were just talking about it with Power of Recovery, and we were saying how when we first started this work almost 10 years ago, we were being told that we had to work with, we had to subcontract with certain organizations that were already doing this work. But when we started to do that, and what we found is, we would do a post-overdose call, and the person would be like, yes, I really want a detox, like, please find me a bed. And then we would send them to our subcontractor, and our subcontractor would say, we would love to work with you, but you don't have the right insurance. And then we look like idiots. And so then we stopped doing that, and we were like, we'll figure it out on our own. It took a little bit longer, but we figured it out. So
It's a shame that if somebody needs that kind of help, that it all depends on insurance.
yeah, oh gosh, yeah. I scream about it at the state level, at the national level, any opportunity I can have. Like, because there's all of this talk about, making things more equitable. And I'm like, you are standing on the most inequitable system as a way to deliver public health. It's mind blowing to me, but nobody will talk about that because I'm sure they make a lot of money and are lobbyists at like a lot of levels.
Acute care health too. It's the same thing, is that there's 3 or 4 different levels of care depending on your insurance status.
Yeah. I know, it's fascinating and also very sad. So, yeah.
And not to interrupt what you said, but in listening to some of the ways you get this information out or find out through the fire department on a call or the police department or something like that, one of the things that I feel is lacking, and I'll just talk about Winthrop. In this day and age, believe it or not, there are still people who don't have computers.
Yeah.
And don't live their life
Yes.
by computers.
Yes.
I don't feel sometimes that Winthrop gets out enough information into the public. It's almost like I feel something should be plastered on, every storefront in the library, every school, everything. And to have the ability to perhaps help people, but then people still really don't know where to go or who to call or how to do this. I think is something that maybe as a community we can work on to get more information out there so people really know about it. It's not because they get the fire department has to come in an emergency.
Right.
And that's how somebody finds out.
Right.
So that's
We
just.
see that, well, we see that largely in the over 60 age group. And so what we're gonna start doing in December is doing coffee with Clear down at the senior center. So Matt agreed to let us come in once a month, and they said, we'll bring treats and or we'll bring lunch. And not do like a program, but just kind of do like a sit, let's chat, and in a more organic way. So it kind of like lowers that threshold for people of like, what are you doing here? Like maybe we'll do a craft or something. Jane is really big into doing crafts. So just kind of like a connection with different kind of groups, so that it might not be the person that's sitting in front of us, but it might be somebody that they know to be like, oh my gosh, like, hey, like we were surprised because we went to, not surprised, but we went to the barbecue at the senior center, and we had our flyers for the recovery event. We had two folks come up to our recovery coaches in tears and say, I lost a child to addiction, and I've never been able to say that. And so it's like, okay, well, say it to us and we can talk to you more about it. Or like, we'd love to hear more about that. And so we figure, well, at the very least, we can just go down and bring some coffee and hang out for an hour and just kind of also hear from folks as to like what they're experiencing in their world. And see how we can like better that.
Go where the troubles are. The middle school thing is a great idea,
Yeah,
because that's where it starts.
Yeah. So we're hoping to get some educational programming into the school. I know that they're like super stagnated by their time and learning and their requirements and things like that. But trying to think outside the box a little bit of how do we get our name out there? What other events can we attend that are maybe not? We tried to go to the farmer's market and they wouldn't let us because we weren't selling anything. So it was a little like,
Really?
You should do some crafts and then you're all set.
just like I could sell you some Narcan, like yeah, she's like, I was like,
Wow.
okay, better luck next year.
Yeah.
So I was like, oh, that'll be nice. Like we could go and.
It'd be wonderful.
Yeah. Well,
Oh.
anyways.
Well, let's hold on to that question. I mean, about why they weren't allowed in the farmer's market.
Yeah.
It's something we want to look into.
Yeah, I was like,
Yeah.
oh, okay.
So, didn't mean to interrupt.
No. So we've been doing our vaccines. We're launching into, we've done a good amount of vaccination the last 3 weeks. We have the high dose vaccine as well for the over 65. We are trying to get the word out that we are still able to do in-home vaccines for people who, but just for flu. We do not, unfortunately, have COVID vaccines this year. And that is a bone of contention for me with the state of Massachusetts, but
Someone just asked me about in-home flu, so it is. still
yeah.
available. Okay,
All they
great.
have to do is call the office and we'll schedule it.
Okay, I'll
Laurie.
get back to them and tell them.
Yeah, and we've been, I think we sent it to Matt too, so he's gonna like kind of push it out to the, and we put it on our social media and things like that. And let's see what else. So we also have some interesting programs going on. So we, for the last 3 years, we've been mentoring other police departments from across the country on how to integrate peer recovery coaches into criminal justice models. So that's through the Bureau of Justice Assistance. So we worked with Eau Claire County, Wisconsin, Alamosa, Colorado, and Linfield. So last year, the Bureau of Justice Assistance, which is under the Department of Justice, paid for them to come to Winthrop, and they spent 3 days here, kind of watching operations, and we reviewed policies that we had written, and kind of just talked about like what worked at the beginning, how we built capacity, how we built like trust with other stakeholders, but kind of some things that we did. And then we are mentoring another department this year from Navajo County, Arizona. So they're coming out next week. They're flying out the 15th and 16th. They'll be here. So we get a $5,000 stipend for that.
What a compliment.
Yes.
Well, it's nice, like, yeah, like I'm waiting, I applied for a large grant through the Department of Justice through BJA. I'm kind of like, guys, like, I feel like we are friends already. So you
Wow.
seem to like what we do. So I seem to want some of your money. So,
You got some.
yeah, so we would probably, so that hasn't come out yet, whether or not, they haven't sent us what their decision was on our grant application, but, so more to come on that. And then we also have a really nice relationship with BU School of Public Health. I really see that it's important to align with academia in some fashion, because especially when I first started working here, I really didn't know very much about public health. I was kind of learned as I went. But one thing that I was really drawn to was trying to see how I could entice the universities that, we have the best universities for public health sitting right in our backyard. How do we entice them to do more practice-based work? And invite them in, like, hey, send me your students. They can learn, public health practice for free. And I would get, some support and some capacity. So BU really jumped at it. And over the last 6 or 7 years, we've built a really nice relationship. So it started off that I worked with one specific class where I gave them a problem statement every semester, and it's changed. I've done it for 7 or 8 years, or 7 or 8 semesters now. And it's almost like a consultation, like they run it like a consulting firm. And I say, the town of Winthrop has this problem. This is what we want from you. And they spend the semester working on it. So they've developed everything from marketing materials to website mockups to chat bots to, their minds are fabulous. And they come up with and they do, one of the biggest things for me is that they do a full literature search based off of the problem. And with that, I've used it so many times in grant applications. So we retain all of the materials. It's not, they don't retain it, like they share it with us. So now I have a whole library of research based off of, so we looked at intimate partner violence, we've done community trauma, they looked at community trauma following the shooting in 2021. And we've used that to leapfrog grants. And it was all for free. And they and some of the students are really excited and they want to write grants. And so they'll actually find grants, write them, mock them up and then send them over. And then I fill in so it takes a burden off of me of writing them. And then since then, we've been published in journal articles with them. We've presented at over 20 presentations on the national level, from APHA to PARI, the Police Assisted Addiction Recovery Initiative. We're invited to speak at their National Law Enforcement Conference in February on building academic partnerships and kind of how that catalyzes public health. This past year, I sat on a doctorate dissertation for a doctorate of public health, and because they needed a local perspective on how to build the workforce of public health as it got decimated during, and then that's been published, and it all of it is tied to the town of Winthrop. All of the indexes are so we're kind of out there on even the academic side. So which when we're seeking money and funding, really lends a lot of credibility to the work that we're doing. Plus, it gives us that third-party evaluation to say, follow this science of it, and this is what they're doing at the national and international level. So, so that's been extremely helpful.
Well, again, to interrupt.
No, you're not interrupting.
Listening to the amazing work that you're doing. the
Oh,
health
I have
department-
a wonderful
the
people,
whole-
people that I
the whole
work
group.
with. Trust me.
What I'm saying is the people of Winthrop don't know this. And, okay, you're published in journals, you have all these organizations you're working with. And these students that you're working with, can any of them write an article,
Yeah.
once a month for the Winthrop transcript, so it becomes a
Yeah.
regular, this is the word from your health department, this is what's going on,
Mhm.
this is what we've done this month, or this week, or this whatever. Here's the information, let's get it out to Winthrop, as well as all these wonderful journals and everything else, because the people of Winthrop do not know this,
Yeah,
and they need to know this. Okay, you're doing amazing work.
I know.
we are doing.
Yes, I
You
know.
Trust me, it's.
This is
That's a
a-
great idea, Jean.
This isn't the little health department that I remember, that people used to come up, can I have my blood pressure taken now?
We still
No.
love that
No,
though.
I know,
We're
and we
taking on
have
my
a very-
business.
We have a great group that does blood pressures,
Yeah.
for the community, but I really think we need to get it out to our own community as well, Meredith.
Yeah, no, I did my first letter to the editor, ever, about the recovery event and like recovery month. And I do need to do that more. I know like that, and people read the letters to the editor. I know that I do anyways, like, and,
I read it cover to cover.
yeah, I know. And I guess like it would probably be, I think it would be well received by
Oh,
the
yeah,
transcript.
yeah.
If we were like, hey, this would be, but yeah, I think that for sure. Yeah, definitely.
It's a great idea.
I just wanted to quickly brief you guys on the opioid mitigation fund monies as well. I don't know how much anybody is aware of kind of the federal legislation, the federal lawsuits and things like that, and what it means like for the state of Massachusetts.
Are we talking about the
farmer.
farmer?
Yeah, exactly. So as a result of the lawsuits that were brought against the major manufacturers and the pharmacies, to date, $55.2 billion have been recovered by the federal government. And out of that $55.2 billion, each state is getting a portion of that. And each state was able to decide what they did with it. So what Massachusetts has done, so the first payments to the states began in September of 2022. So what each state has the discretion to determine how their funds will be spent. I was at a conference in New Orleans, it was a law conference in May, and sat in on a wonderfully done session purely about mitigation funds. And it was really interesting to see how different states were doing it. Like last year, we also mentored a health department from Mobile County, Alabama. They are seeing $0. That health department has zero access to opioid mitigation funds. They have to ask permission to even purchase naloxone. And so it's really one of the things that I do love. There's a lot of things that I like about like these mentoring. It's extra work, but I really don't think of it as extra work. It's really interesting to see how public health is applied in other parts of the country. And so Mississippi has already said, Mississippi, Alabama are just two examples. Michigan's another one that they have said that there will be zero transparency in how they spend money. So the federal government is really encouraging states not to do that. They're saying we really would like for you to be transparent, because we want this money to not go to like rebuilding your roads or something. It should go to the actual mitigation of the opioid crisis, which we know was, these are states that were very hit hard by the opioid crisis, continue to be hit hard by the opioid crisis. So the Massachusetts Attorney General's office is leading our opioid mitigation fund here in Massachusetts. So Massachusetts in total will receive almost $1 billion like over the course of the settlement. The settlements will take about 18 years to roll in. We get different amounts each year. So what Massachusetts is doing is 60% of it's $975 million right now. 60% will go to statewide initiatives. Really, and they put together a really nice report and a strategic plan on what they're going to use those funds for, 100% transparent. And they really want to fund prevention, harm reduction, and recovery programs, which is great. There's this whole like language around you don't want to supplant the work that you're doing. So like it wouldn't make sense for us to necessarily use opioid mitigation funds to pay our peer recovery coach staff because we've already been doing that. What else can we do? We want to mitigate what else can we launch off of that? And 40% of that monies will go directly to the municipality. So we've already received, it's weird how they come in, but, and Winthrop has been, the leadership here has really given us a lot of autonomy to decide how we're going to spend or what we think we should be doing with that money. So the funds can, interestingly, even though it's called opioid mitigation money, the funds can support all aspects of addiction and mental health. It does not have to be solely focused on opioids, which is huge. We were kind of reminiscing about how when we first started outreach, it was, the money was tied to opioid overdose prevention. And, when Chip McHugh, our recovery coach, would go out, as word kind of spread, we also realized that there were folks in the community that were having struggles with addiction that maybe weren't opioid related. And, we were getting frustrated because it's like, gosh, I really wish that we could help you, but if you don't shoot heroin, we really can't help you like that. And it was like, well, this is stupid. We can't do this. Like, this is unethical. And so we figured out a way around it. And so the guidance suggests the formation of community advisory boards or council to guide the implementation. So we've started doing some of that work. It overlays with a lot of the other work that we're doing. So we're trying to streamline it and not ask people to go to 65 meetings a month or like all of that. And really want to solicit the community input regarding how the money should be spent. I feel like Meredith, really should not be deciding how that money is spent. So we have a plan on community engagement. We have some listening sessions coming up. We want to do like a community forum. Some of it will be online. Some of it will be just surveys and like quick, fast. In November, there's going to be the Winthrop Health Forum again in November, and we want to have people there with iPads and just give us your opinion on it. There's nobody, I can't say that there's nobody, but I would say that there are very few people in this community or any community that doesn't know somebody that's been impacted by addiction in general. And, we've had the opportunity to really sit with folks that are currently in experiencing addiction, that are, maybe newly into recovery or long-term recovery. And, kind of it's asking them, what do you see the need to be? And what we've heard so far, and we're considering how to build a framework, which might be kind of putting a nonprofit arm on the health department, for example, like scholarships to detox, like paying for sober housing. One of my personal foci, or I would really love to hear from parents or the grandparents or family about the children. We're now seeing, we've been in this crisis for almost 30 years. And that's just the opioid driven crisis. But how do we let people know, like for children that are now in their teens and 20s that are experiencing those after effects of trauma of either being part of a family that's really deep in addiction or losing a parent from addiction, and not having any resources, like how do we really take care of those human beings? But not just on the individual level, we're trying to look at all of the different levels, community, interpersonal, and kind of organizationally. One of our meetings today was about employee assistance programming for Winthrop, like, other than just that number on the back of your insurance card. Like, how do you kind of get the word out there to kind of support people as they're navigating the disease of addiction or mental health, to create just wellness? And I think that there's some really cool opportunities or really impactful opportunities that we can do. right now we're seeing a bump up of like a significant, actually, I'm going to be in Denise's office on Thursday doing another series of death certificate reviews because what my gut is telling me, and I don't have it like specific, is that we are losing brown and black men ages 19 to 24 at a much higher rate this year than before. And what I think it is from is counterfeit Percocet and OxyContin pills that are pure fentanyl. So that is just like a different trend that we're seeing. And so I talked at length with the superintendent about putting, if you're seeing young men dying at 19 and 20, there's a potential like drift into our high school population. And we really need to put more naloxone in schools, Miller Field, like in just buying naloxone boxes. And kind of getting that word out there in some way. So that's one piece of it. The city of Revere has put naloxone boxes all throughout their city. I want to be more targeted as to where we need to put these kind of resources and hearing from using the data, but also the input of people where we should put them. I was talking to a Revere firefighter today and he said that they've already had 2 people saved from their naloxone boxes in the city of Revere. But
They have
they're
them on the
really,
streets, don't they?
what's that?
They have them on the street.
They have them on the streets, which they kind of know their hotspot areas and we don't necessarily have that. But anyways, the more like, those are just kind of thoughts around like the opioid mitigation monies.
Meredith, does the school department still teach health?
I think it's a half a year in freshman year.
Because my question is, I mean, in classes like that, I mean, not only should things like CPR and things be taught, but, the issue of Narcan, we were talking about that before, comes up and, should they be trained in the use of Narcan? Where they're freshmen, I don't know, but,
It's actually something we were gonna talk about.
Okay.
Because
yeah.
I don't think it went to you, but I don't want to interrupt you.
Oh, no, I'm
so
kind of all done,
You
so.
are, okay.
I did my spiel.
All done, I'm exhausted with all the things.
Actually, well, the only other thing I wanted, so in October 21st, we were invited to speak at the International Association of Chiefs of Police Conference it's in Boston,
Oh
so
my
we're
God,
dragging
yeah.
Terry in and we're gonna showcase it. It's like a big deal for all the police, but it's all about how to do behavioral health and yeah, so that'll be a nice, that'll be great to kind of talk through, some of the things that we're doing and great to talk to like other police departments that are really struggling. I was on a call a couple months ago with, it was a fatality review board in Michigan and there was a sheriff on there and we handle fentanyl test strips for folks like who are actively in use to check for fentanyl within their whatever they're using, because we figure they're better off staying alive than not. And this chief got so mad at me. He was the sheriff and he was like, and so there are those strong feelings out there against harm reduction. And
Definitely.
yeah, and so I mean, and there's space for both, right? There has to be the punitive, there has to be people getting arrested for distribution, like there has to be that. And it gives the police departments a way to balance it with the inclusion of like these offerings.
It might be generational too. I mean, there's harm reduction was probably 25 years ago when it started.
Yeah. Well, and what there's, whereas what they're trying to look at the application of opioid mitigation fund money, less against like what the tobacco industry did, like when they had all of their lawsuits, they said that didn't go well. They're really looking at the response to the AIDS and HIV epidemic, about how it included so many people that of the advocates for primarily like the LGBTQ community. And it took them to come out of the woodwork and to say, this is what we're seeing, this is what we need. And that's how they were able to make some traction within that. So that's what they're kind of leaning towards more, which is interesting.
Well, one of the reasons I felt it was really important to have you come and speak and for the Board of Health to be televised, to hopefully get this out over the airways, so to speak.
Yeah.
So more people are aware, but also what can we as a board do to help you to get more of this information out to the community,
Yeah, well, I think that people are going to be talking to you more and just kind of being like the mouthpiece for a lot of this. And trust me, I'm going to be probably peppering you with more emails of like, hey, can you come to our listening session? Hey, can you come to this? Hey, can you and even by having, even if you may think that you don't have a lot to say, which I think all three of you do, listening to what other people in the community are saying, I think will be really interesting. And, we want to give as many opportunities as possible. A lot of people don't want to go to a public forum and say, hey, this is what I think. So even, an anonymous email or an anonymous survey, and we want to compile those. And we're, working with our evaluators from BU to compile those so that it's done in a authentic, unbiased, kind of more, evaluation-based science piece.
Although I haven't found the people of Winthrop are very shy about saying what they think.
No.
And I think that's good.
I think so too. I think so too. I think, there's still so much stigma related to mental health and of course, like we could talk ad nauseum about the impacts of the pandemic and we're looking more at the science of resiliency. How do we create a more resilient community versus just like, oh, hey, we're going to prepare for the next pandemic, or hey, we're going to prepare for this one specific thing. We're in the fourth wave now of the opioid epidemic, and we saw the first wave and responded to that, and now we're seeing it evolve. So if we can be a more have the ability to evolve as a community and build the resiliency. I think that, and Winthrop's unique because how tight knit it is, there's this whole notion that, a community is very protected with social cohesion, and Winthrop has a ton of cohesion because people are as somebody who didn't grow up here, it's been really interesting to see how when there's a big event, whether it's a COVID pandemic, whether it's a massive apartment fire, whether it's a hate crime on Shirley Street, it is felt, you can feel it. You can feel the energy here because people are so connected. Mm-hmm. And it absorbs a lot more because the community is connected, but it impacts it a lot more because the community is connected. So just putting those resilient pieces and understanding how to build the resiliency and not just being one specific thing, like not just opioids, not just, mental health crisis, but just in general.
Mm-hmm. Well, and listening to you, one suggestion, as I started to say, is with the students that you have, maybe while you have them, get them to write an article once a week in the transcript to put that in. And maybe do some public speaking in classrooms in the school. Mm-hmm. Different things like that. Get this out there, that all the stuff that you're doing, because it's very important.
Yeah, it's been very interesting.
So glad you came.
Oh, thanks.
Thank you very much.
Yeah, no worries.
Very informative.
If you guys have any questions, just let me
I did want to run this by you.
Yeah.
The Board of Health received an email from a
Harvard undergrad.
Yeah. I'll just read it quickly. My name is Sahani Megatori. I'm an undergrad student at Harvard University studying neuroscience with a minor in global health and health policy. I am reaching out to you regarding an initiative I am leading to enhance K-12 health education in Massachusetts in collaboration with Dr. Scott Weiner, an emergency and addiction medicine physician at Brigham and Women's Hospital. We are working to increase the education and awareness on the use of naloxone among high school students across the state. It goes on to tell what naloxone is. The effort is in collaboration with Stepping Stone, Brigham and Women's Hospital, and the Naloxone projects. We have already started working with school districts across the state, including Lexington, Waltham, and Framingham. I would greatly appreciate the opportunity to discuss this initiative with you and or the Board of Health to see if there is space for collaboration in Winthrop. I'm just not sure what would be the steps to take.
If you want to send that to me, if you don't mind forwarding that to me, I'm happy to reach out. I feel like we are now on the impetus of potentially exploring that within, whether it's through the school or just as a community. And I know my own 16-year-old asked me last week if he could carry naloxone. And so, not for any reason other than he was really taken aback by a recent documentary that he watched. And he was like, Mom, like, you know, he was just asking me, I said, yeah. And he, you know, just asked me a lot of questions. So I think that kids will ask these questions, you
Right.
know, and,
Right.
and if we're going to have the presence in the high school, it's good to have an explanation for it. Like, instead of just throwing up a naloxone box, be like, hey, or like a Narcan box, like, hey, this is what it's for. And like, no, you know, you won't hurt somebody by, you know, giving it. And, you know, I always feel like it's like my mom was a teacher and, you know, being mindful of the demands that are put on schools, right? Like it seems natural, like,
Right.
oh my gosh, like we went through this every time that we train them in tourniquet training, right? Like it's not their job. Like I'm sorry, like it's heartbreaking that this comes into our schools, right? It's not just about reading, writing, and math. We are asking them like a whole breadth of things. And then on the flip side of that, it's like, you know, as parents, we say these are the helpers, right? So like, how do we, you know, is it a requirement of their job? No. Should it be a requirement of their job? No. But kind of giving them, anybody, the tools to say, because we know that quite frankly, like the mental anguish and the PTSD, like after witnessing like a traumatic death, you know, one of the first things people say is, I wish I could have done more. Right. And so it's like, even if you tried and the outcome was still a fatality, there was an attempt and it helps also kind of the survivor to say, I did something.
It's hard to know whether it's just a, you know, one class or two classes if he's an undergrad or whether there's a program that's going to continue. So
Yeah.
we have to, you'd
Yeah,
have to take
happy to explore more. Yeah.
Okay, so I'll forward this to you.
Yeah.
I just don't know how the schools would feel
Yeah.
about it.
But I wonder if even like the school doesn't have the capacity to do it, how we can work it into the existing programming that we're doing.
Yes,
Or also even with CASA.
yes,
Right?
yes.
Well, there's some precedent. 3 other towns are having
Yeah.
their schools
Mhm.
be part of the program. So.
I mean, I'd also be interested to hear, you know, you mentioned Framingham and Sean Riley, who lives here in town, is the assistant chief in Framingham. And like,
Oh.
see if he's had any experience with it. That's what I think.
Oh,
I would
Well,
reach out to him
assistant chief
in Framingham. Assistant
Deputy
chief,
chief.
deputy chief.
Sean Riley's the deputy
of
chief.
fire or
Oh, no.
police.
Oh, fire, Framingham Police.
police? Okay.
Yeah, so
okay.
he's a Winthrop guy, born and
Yeah, I
bred. that
worked
lives
with
here.
at the food bank.
Yeah, he's wonderful guy,
Wonderful.
very quiet, like he's always under the radar,
Right.
so very thrilled that we're
Yeah,
talking about him.
Very impressive.
Yeah.
Well, being a former school teacher, I feel that there is always room in the school. Okay, so if one class is taking away one day to teach students, for example, a CPR class, or to teach them how to administer this drug, or to talk about things that deal with mental health, there is room in the school department to do this.
Yeah.
And a school department that says there is no room is wrong.
Yeah.
Is wrong,
Yeah,
because there is room always
yeah,
to do this. And I think that unfortunately, in today's world, our kids need to learn that,
yeah,
you know, at the age that they are,
yeah.
you know, so.
They're exposed to so much on social media that like, you know, they weren't before. And so when we talk about like, oh my gosh, this is gonna be jarring to them, is it though? Because they, you know,
Yeah.
they're far smarter than we usually
know.
give them
But
credit
yeah, I
for.
know. But doing CPR class is one thing, but administering Narcan to a person who's basically dead is much more difficult. And
Yeah.
so Anyway.
Yeah.
Thank you
Hey,
so
no problem.
much.
No problem.
Not only
Any
for
other
the
questions?
presentation today, but for what you do.
Oh,
Yes.
no,
Very much.
no, it's lovely. I
It's
think it's a great
remarkable.
privilege.
Thank you,
Do you mind
Mary.
if I scoot? I'm gonna go.
Not at all.
Yeah.
Not at all. We don't hold prisoners.
Okay.
A credit to our town. Thank you.
Oh, you guys are sweet.
Okay. The next item on the agenda is update from the Inspectional Services Department. And I received an email from Sharon Sicarella, so I will just read that out loud. And Lisa, I'm going to. You'll have it, you don't have to, you can just copy paste it. Here's a quick summary of what ISD is doing. Ongoing inspections with construction permits, food inspections, problem properties. Beacon Street is dealing with the trash weekly now. There was a tenant who moved out causing all the trash, but ISD will monitor for a bit. Habitability inspections ongoing. Grease trap inspections being done. Restaurant inspections continue. A problematic laundromat on Shirley Street was shut down. ISD shut it down for a week. They were able to reopen after everything was re-inspected. Governor's Park mold situation was handled. I just want to expand on 26 Beacon Street. We received a complaint from a neighbor regarding a problem with the overflowing trash barrels. It was a 6-unit apartment building, so the trash is not picked up by the town. What was happening, the barrels were in the area between 2 houses. The houses were very close together. And the neighbors were very concerned because trash wasn't fitting in the barrels. It was being put in the ground, and there was an indication that there was a problem with cockroaches. They were very also concerned about rodents. As soon as Inspectional Services was notified of this situation, they went out immediately and they continued to follow up. We got a couple more additional emails. So they really took care of the situation very quickly and very thoroughly and communicated back to the people who sent the emails. So I just thank them for their hard work on figuring out this situation, getting it resolved. Okay.
One of the guests that we hope to have in the future is the person in charge of the trash, I guess, it's the simplest way to put it, to come in to really go over some of the rules, the regulations, the sticker process, et cetera, because there are still a lot of people who don't understand. And so we want to do that, especially with winter approaching, and if we have snow and the trash that's put out, we just want to make sure that it's healthy and it's safe. So that'll be one of the people that we hope to have in the future. And some of the other people that we hope to have are people who deal with health, safety, like our fire chief, our police chief. We will have our inspectors come in person, we hope, in the future, to talk about the restaurant situation that will take effect in, is it January?
January 1st,
January
2025.
1st, with the health rating system. And we want people to understand that. So hopefully the people that we have come in will be helpful for the community. And before I forget, I want to introduce Lisa Stefano, who is our clerk, who is, especially me, we really need her.
Yes, welcome and thank you.
Thank you.
I know it's not public comment, it's all over.
That's
but,
okay. Go ahead.
Recently, I went to the high school for the town clerk's office to register kids to vote. And I was right outside right by the gymnasium as you enter the cafeteria area. And although I didn't have a lot of kids come in to vote, I had a lot of kids stop and ask questions. So I don't know if that would behoove you to do something like that, at the lunchtime hour, just to get kids started to get interested in what's going on. It's just a thought.
That's a great idea.
If you want, if you want to do it, and Nat was very willing. He rolled out the red carpet as far as I was concerned. And it did work out. Like I said, you get a lot of kids to register,
Yeah.
but a lot of kids, they stop because they look to see what you've got, and then they start to ask questions.
So you're talking in relation not just to for kids to vote, but
No, I'm talking about
Us,
what
about
you're
town
talking
and
about. I'm
it
just
would be
sharing
us.
my experience.
yeah, I agree.
You
I
know,
agree wholeheartedly.
Wonderful, thank you. Okay, the next item on the agenda is, are there any proposed agenda items for next meeting? Anybody have anything you'd like to see us discuss at the next meeting?
And can't they, write to us
Yes.
at the,
Yeah, emails can be sent to the Board of Health. You can find the link to it on the town website.
Denise?
What a phone number, if may I ask? I don't have a computer, and I rely on the telephone, so a telephone number is very helpful.
Denise, do you know if there is a phone number for calls? For
Yeah,
somebody
we
who
usually take
wanted-
them to the town clerk's office, so it would be the 617-846-1852. And if you would just refer to the town clerk's office, then I'll make sure that you get whatever information someone's looking for.
Thank you.
Thank you.
Denise.
And not that I anticipate today that we have anybody on Zoom, but do we have anybody on Zoom?
Not today, no.
But the link was not published ahead of
Yeah.
time, right?
No, it was.
Oh, it was? Oh,
Yep.
Thank you.
Yep.
I didn't realize that.
No problem.
Next item, unless there's anything else, anybody want to bring up anything? Next item is adjournment. So, motion to adjourn the meeting at 5:37. What, 4:37? 4:37.
I was gonna say.
I second that. Yeah, I know, it's like, yeah. Okay.